láwọn ìlú kan tíjọba wọn ti help wọn irú èèyàn bẹ́ẹ̀ ọ̀fẹ́ náà máa ṣe dialysis fún wọn a máa lọ ṣe dialysis a kàn máa lọ ṣe lọ́fẹ̀ẹ́ ni irú ẹ̀ bẹ́ẹ̀ lè live long kò ní sí disturbance. Another treatment is renal transplant wọ́n á lọ níbi accumulative rẹ̀ kan kó donate kidney méjìlá ní ẹyọ kan ti wà enough so ẹnìkan lè donate ẹyọ kan fún ẹlòmíì iye tí wọ́n ń ṣe sọ́jú yẹn òun ṣòro kékeré. Ẹ mọ̀ mo mú àwọn example àwọn disease wa so that you can see that it's a serious thing. Ẹni tó bá live ìgbésí ayé ẹ̀ nígbà tí ajọ 10 years ago ìkànnì àwọn young doctors tó bẹ̀rẹ̀ school lọ́dà wa àti àti mo ti wà ní school bàtẹ́lì ń kó school òun wọ school so bíi pé a mo accommodate ẹ̀. Later when I came back then òun náà ti di doctor young doctor wọ́n wá gbẹ̀gbọ́n ẹ̀ wá sí hospital ẹ̀gbọ́n ẹ̀ ti ní heart failure tó bá rìn díẹ̀ a máa mi hẹ̀rẹ̀ tó bá rìn díẹ̀ a máa mi hẹ̀rẹ̀ wọ́n ṣe ànáwó àtúntì wọ́n ṣe oúnjẹ bẹ̀tẹ̀ wọ́n náwó ó tún padà sí ìdìkan tó ṣe kí ló ṣe ó máa mọtí mùkúmù abúyẹ̀ wọn sọ pé ókè ní ìgbà tó mọtí kiri yìí kò ní dúró lé ìyàwó máa complain a lọ mọtí kò mówó ńlẹ̀ ọtí tó mú kiri ó ti kó bá iṣẹ́ tó ṣe ẹ̀dẹ̀ tó ń lówó tó fi mọtí kò tiẹ̀ ṣiṣẹ́ mọ́ ìyàwó tó ń fi ilẹ̀ ilé náà ló wá ṣe wàhálà tó tún wá ń gbé wá sí àtàwọn àbúrò ló tún dáwó láti máa treat àbí ẹni tí ó bá refuse ẹni tí ó bá kọ̀ láti take care ẹ̀ kí ló máa ṣẹlẹ̀ ẹ mọ̀ kí náà ìgbẹ̀mú sọ pé èèyàn lè ṣe gbogbo ẹ̀ ó lè at the end of the day kó sì ní some of this condition àmọ́ at that point a mọ̀ pé owó ọ̀rọ̀ òun kọ́ ni òun fi fà mọ́ àwọn Yorùbá máa ń sọ pé alágẹmọ tó ń ṣe jẹ́jẹ́ ikú pa bàlàtà sí kí ni ọ̀pọ̀lọ́ tó ń jọ rẹ̀ mọ́lẹ̀ àwọn young person lè máa mọ̀ tí alágẹmọ is chameleon works very slowly àbí ó sì máa ń rèlè díẹ̀díẹ̀ tó bá yá kí ni ó sì máa kú. That means the person that is careful is taking his life seriously he will still die maybe he will live long at least live a healthy life. Talkless of someone that is careless, living reckless life. That is the essence of our discussion. So, not to mention many parts of the body tí disease dey affect. Ẹni tí wọ́n ní kí take care rẹ̀ lóògùn ẹ̀ tó lówó lò. Tí o máa rìn títì, ṣé o lè mọ̀ bóyá ó ní hypertension? Wọ́n lè mọ̀ náà, àbí? Tí o bá ní tí o lè mọ̀, èèyàn lè mọ̀ ẹni tó máa ní hypertension, ṣé èèyàn lè mọ̀ lójú títì? Ẹni tó máa ní diabetes, if someone is diabetic, will you know if person is walking on the road? You wouldn't know. You can't. But tí o bá take care ẹ̀, tó bá ní stroke, ṣé máa mọ̀ tó bá ní stroke? Ẹ máa mọ̀ tó bá ṣe rìn náà, ẹ mọ̀. Ọwọ́ ẹ̀ ò ní balance mọ́, àbí ẹsẹ̀ ò ní balance mọ́, like that. So that's why I say that pé effort to take care of yourself, and this is one thing I need to start from that beginning. When we say healthy lifestyle, we are not referring to adults alone. Sọ̀rọ̀ nípa pé àgbàlagbà nìkan o. Healthy lifestyle, we are not referring to only adults. Àgbàlagbà nìkan kọ́ la sọ pé kó máa gbé ìgbésí healthy life o. Àti kékeré la ṣe máa put our on the right perspective. Tí èèyàn bá ń ṣe ọbẹ̀, kì í ṣe ìgbà tí èèyàn bá gbé sórí iná ló máa jiná, àbí? Tí èèyàn bá ń ṣe ọbẹ̀, if you are cooking, it is not the same time you put on the fire, on the stove, or the gas for it to be ready. Ẹ máa gbé sórí iná, ẹ máa fòróró sí, ẹ máa fata sí, ẹ fi ẹja, ẹ fi kíní kan, ó bẹ̀rẹ̀ máa mix papọ̀ díẹ̀díẹ̀, tó bá yá máa ní pé kí ni ó ti jiná. The same thing applies to most of the diseases, conditions we have. The person that has hypertension today, it is not today, don't do hypertension o. Nǹkan tó ní hypertension yẹn kí ni? I think stable láti many years. What is leading to the hypertension? It's cooking. It's been cooking gradually. Wrong lifestyle. As a young boy, smoking at the age of 14, 15, taking alcohol. You know, will you be hypertensive by that time? Most likely, you will not be hypertensive. Abi, only man hypertension now. But maybe at the age of 30 or 25, hypertension will set in. So when we say healthy lifestyle, it means it's something we should teach our children even growing up. It's a natural thing to buy crates of Coke, Fanta, kéèyàn kan load rẹ̀ sínú fridge, kéèyàn ní Fanta Coke nílé, àwọn ọmọ kan máa mú anything tó bá wù wọ́n. Those are not, you are not training your children on healthy paths. When you allow them on unrestricted access to whatever thing, unhealthy food, ọmọdé ni wọ́n máa born ẹ̀. This is not always true. So, eléyìí tí mo sọ fún wa, just for us to realize pé there can be problem. Abi, no matter how rich somebody is, oh no, almost 200,000 every month, sorry, every week, lórí kidney problem ẹ̀. If it doesn't take time, ó máa dẹ́dún arílẹ̀, owó máa tán. So, mo ti sọ̀rọ̀ nípa health fún wa briefly. Now, kí ni àwọn nǹkan tó máa ń fa àwọn nǹkan tá a mention? You know, it is not enough just to mention it. As you mention stroke, ẹni tó bá ní stroke, ó lè kú lójijì, very common. Sudden death is very common. There are instances, there was a guy that was driving, lóṣòdì, ó ń wa mọ́tò. Suddenly, the car was just drifting off the road. Ó hit cover. They got there, they met him. They can't even rush him to the hospital. He had stroke while he was driving. Stroke. There are so many accidents that you got to ṣẹlẹ̀ sí driver, but you only stroke or only heart attack. That's why all this public transport. Ideally, government yẹ kó máa check, and unfortunately, tẹ́ bá lọ wá àwọn group of people tó ní ìwà àbàjẹ́ lọ́wọ́ jù, àwọn tó mọtí jù, the highest prevalence of people drinking alcohol, cigarette smoking, ìbílẹ̀ máa ti bá wọn. Transporters ni wọ́n náà, àwọn ní National Union of Road Transport Worker, garage wọn, ẹ̀rí oríṣiríṣi ń bẹ. These are the people that are committing buses carrying a lot of people. Imagine kẹ́ni tó ń drive before ẹ̀kọ́ ní stroke, àwọn mọ́tò lọ sínú omi, ó ti pa àwọn èèyàn sínú mọ́tò tó wà nìkú. So it's something that happens with grave consequences. Grave consequences lórí ẹni tó ṣẹlẹ̀ sí, especially nínú wa ìbùtọ́ pé most people daily earning ni wọ́n caricature, you work, you eat. Owó tó máa ná lé ní, wọ́n máa lọ ná, èyí náà máa pa. Owó tó ná lé alẹ́ tó máa ná lé ní, owó tó máa pa lé ní náà máa ná. Tó bá ṣọ̀la, tí wọ́n bá lọ sí ọjà ní ọjọ́ méjì, kò sówó. Imagine kẹ́ni ẹ wá lọ ní disability, stroke, ọ̀wọ̀tẹ́ tí ò lè lọ sọ́jà mọ́. There's a problem. So, gbogbo àwọn condition yìí, they come with grave consequences. So, kí ni àwọn kan tó ń fa àwọn kan yìí? So, it is not enough that we mention them. We have to talk about kí ni àwọn common causes. We call it cardiovascular disease. Why are we calling cardiovascular disease? Mo ti explain fún wa. Cardio means heart. Abi, cardiac, cardiology, cardiac means heart. Vascular means vessel. Those are the pipes. So heart is the pumping machine. Abi, vascular is the pipes carrying the blood around. So disease here, we call them together cardiovascular disease. Disease of the pump and the pipes. I want to mention for you. But when there's a disease of pump and pipe, we can cause stroke, heart failure, heart attack, all those kidney problem. There's even peripheral artery disease. Ṣé mọ̀ pé àwọn pipe yẹn ló gbẹ́jẹ̀ lọ sí ẹsẹ̀. Ẹ̀jẹ̀ tó ń dé bí muscle ẹsẹ̀ la fi ń rìn. Tí àwọn pipe yẹn bá block, or tó bá ti ń block díẹ̀díẹ̀, ẹ̀rẹ́ ẹni tó ń rìn tó bá ń rìn díẹ̀díẹ̀, ẹ̀yìn ẹsẹ̀ máa dùn. Ó máa ní láti jókòó díẹ̀. Tó bá rest, á lọ ọ́ lè rìn dé. Tó bá rìn díẹ̀, tó bá tún ẹ̀yìn ẹsẹ̀ máa dùn. Òun ni pé àwọn pipe tó ń gbé ẹ̀jẹ̀ lọ sí ẹsẹ̀ yẹn ti ní problem. Tó bá ní problem tó bá serious débi kan, ẹlòmíì máa ń lead sí kíni amputation, máa gé ẹsẹ̀ yẹn torí pé ìgbà míì kíni ẹ máa block pátápátá. Tí ẹ̀jẹ̀ ò bá lè dé any part of ara mọ́, ibẹ̀ yẹn máa jẹrà ni. So wọ́n máa ní láti gé kúrò. Is that bad? So kí ni àwọn kan ń fa àwọn blood disease yìí? Unfortunately, èyàn ò lè fọwọ́ mú nǹkan kan kóhun ló ń fà á. Èyàn ò lè fọwọ́ mú nǹkan kóhun ló ń fà á. Ẹ jẹ́ fún example. Driver àwọn mọ́tò l'accident. A ní kí ló fà á tí mọ́tò fi l'accident. nígbà míì kó lè jẹ́ wá jẹ́ ìkọ̀kan ló ń fà á combination of many things ọ̀nà ò dáa táyà mọ́tò ní problem bí tí driver ti wa mọ́tò táyà yẹn ó jẹ́ ó bọ́ sí gallop táyà tí ò dáa wá bẹ́ àbí driver ń play music àbí kò concentrate ó tẹ brake mọ́tò sọ wá sọ ṣe rí pé tẹ́ bá ní fún yín ní pé kí ló fa accident yẹn kí ló bá sọ nǹkan tó fà á pọ̀ ẹ bá máa ka àwọn nǹkan tí ó fà á àwọn nǹkan bẹ́ẹ̀ là ń pè ní kí ni risk factors kí ni risk factors ẹni tí ó ń wa mọ́tò tó ń tẹ fóònù àbí ó ní risk láti ní accident àbí bọ́ọ̀ lè má ní accident o but there is a high risk yóò lè ní accident so we call them risk factors Jerry, number one risk factor for all these disease number one all over the world is hypertension hypertension is number one risk factor fún gbogbo àwọn disease tàbí rẹ̀ stroke heart attack gbogbo ẹ̀ hypertension and the saddest thing about hypertension is that it is very common ó common gan ó common very common as we speak in Nigeria but wọ́n ṣe survey wọ́n ní 3 out of 10 Nigerian adult Nigerian has hypertension that means pé kẹ́ni inú ẹni mẹ́wàá àbí ẹni mẹ́ta ó capacity divided á jẹ́ inú ẹni mẹ́ta ẹni mélòó èèyàn kan àbí láti tó bá mú èèyàn mẹ́ta one of them probably is what is hypertensive that's the meaning that's the import so it's very common when someone is hypertensive unfortunately most times just like what I said earlier kì í ṣe ìpàtí ẹ̀ bá gbóúnjẹ sórí iná ló máa jìnnà ẹni tó fẹ́ develop hypertension the risk ó ti bẹ̀rẹ̀ láti ìbẹ̀rẹ̀ àbí ó máa wá sókè so even before I go to hypertension let's even be methodological ẹ jẹ́ ká divide àwọn risk tí à ń sọ yìí mo fẹ́ divide sí méjì àwọn risk kan wà á pè wọ́n ní non-modifiable risk factor màá sọ túmọ̀ sí àwọn kan á pè wọ́n ní modifiable risk factor non-modifiable risk factor mean pé there are risk of this disease that you cannot do anything about there are risk but you can't do anything about them màá fún ilé example age is an example the older you get the higher the risk of developing all these conditions the older you get Yorùbá ní pé ó pẹ́ láyé ojú yóò ní rí bí kí ni ẹ̀kọ́ lọ́wọ́ fọwọ́ mú bẹ́ẹ̀ it's the reality of life it's the reality of life the older you get the higher the chance of developing it ẹni tí ò bá ní hypertension at the age of 50 tó bá pé 60 bóyá ó máa ní tí ò bá ní 60 tó bá pé 70 bóyá ó máa ní tí ò bá ní 70 bóyá 80 bóyá 90 bóyá 100 the longer the person stays the higher the chance of what developing it so can we do anything about the age no àmọ́ káwọn ẹ̀ máa ń yí age wọn nowadays a máa ń ráwọn patient tó bá ti wá sí hospital a bá ń kọ̀wé kí lorúkọ yín kí ni age yín wọ́n máa dákẹ́ kí ni age yín 42 ló wà nínú ìwé actually 49 years old ni mí 49 okay 42 but the risk of disease is based on that 49 abi so even if you change your age on the paper your real age is still your age and the older you get the higher the risk of developing it's just like in women when women grow older they develop menopause abi menopause they stop menstruating it is common that means the older you get see wọn ṣe máa ṣe ń dàgbà sí ló máa ní the menopause higher abi it is not the same age some will get at 40 something some will get at 50 but as you are growing older there is a chance the same thing applies the second one is gender ọkùnrin obìnrin àwọn ọkùnrin ní higher risk of gbogbo àwọn disease yìí mọ́ ọkùnrin àwọn ọkùnrin tó ní stroke ló pọ̀ ju obìnrin lọ àwọn ọkùnrin tó ní heart attack ló pọ̀ ju obìnrin lọ àwọn ọkùnrin tó ní kíní ló pọ̀ why I don't know but one of the things I will explain ni pé àwọn obìnrin máa ń produce hormone kan tó máa ń protect wọn because they call it estrogen the female reproductive hormone ó máa ń protect wọn ó máa ń fún wọn ní some protection against àwọn disease yìí that is why àwọn tó bá lọ sí emergency medical emergency ẹni pé mójú àwọn tó bá ní stroke tó wáyé ọkùnrin pọ̀ wọn ju obìnrin lọ But there's nothing you can do about your gender. Tọ́wọ́ jẹ́ ọkùnrin ní ọkùnrin náà ní ẹ̀ ò lè sọ pé ó fẹ́ change sí obìnrin àbí? So there's nothing you can do about that. The risk is the risk. Àwọn kan lè sọ pé àwọn èèyàn kan àwọn ní wọn ló TV wọn pé nísìnyí obìnrin làwọn sì yóò ó ń tọrọ ẹ̀jẹ̀ ni. This condition yẹn risk here is still there as a man. So race is also a risk. Race. What do I mean by race? Our Africans, we have higher risk of complication from hypertension, especially stroke, more than our whites. Africans have higher risk. Tẹ́bá lọ sọ́dọ̀ tí wọ́n náà ní ti sí wọn. For example, tẹ́bá lọ sí ìlú bí India, for example. Tẹ́bá rí àwọn tó máa ní heart attack, wọ́n pọ̀ gan bẹ́ẹ̀, wọ́n ní very high rate of heart attack, wọ́n very high, ó pọ̀ gan bẹ́ẹ̀. Ó lè máa pọ̀ tó yẹn ní Nàìjíríà, but àwọn tó ní stroke ní Nàìjíríà is very very high. So, depend lórí bóyá black ní Arab ní ethnic risk, there's also a risk of cardiovascular disease based on your race. Ìyẹn, there's nothing we can do about it. Ṣé mo ká àlè ṣe wọ́n pa àwọn yẹn? So, but àwọn ètò wà important jù ní àwọn èyí tí a lè ṣe ìkan nípa ẹ̀. For example, fún example, for ẹni tó mọtí ọtí ló jẹ́ kó lọ ní stroke. Tó bá jẹ́ pé nígbà tó mọtí tó ní high blood pressure, wọ́n sọ pé kó má mu ìmúkúmu mọ́. Ṣé mo ká àlè ó lè ṣe nǹkan pa yẹn? Tó bá stop láti máa mọtí, risk ẹ̀ máa lọlẹ̀, àbí? So, àwọn èyí tí a lè ṣe nǹkan pa, that means we can modify it. Example is called for number one, hypertension. It's very, very common. And what is important is that because hypertension, it doesn't show. You cannot, if you come to this room now and they give you an assignment, can you pick out all the people that are hypertensive in this room? Any magbodo kò lè pick here. So even if you think that in the older men is a lie, there are people that are old, keep people normal. You understand? So hypertension won't show on the face, but it is causing the damage what? Inside. It is like kí àpáta wà níbi omi tó ń kán. Tẹ́ bá rí omi tó ń kán sórí àpáta kí lẹ máa feel? Ẹ máa feel pé kò lè ṣe nǹkan kan fún. Àbí omi ń kán sórí àpáta. Will you see anything? No. But leave it for years. For years. What will happen? Ẹ máa rí àká yẹn níbi àpáta yẹn. Bí hypertension ṣe máa damage ara díẹ̀ nìyẹn. So, máa ṣe mention bá ṣe lè help ara wa lórí àwọn kìnìyàn. Diabetes, sugar, excess sugar in the body. You know, I gave an example of, there are people tó jẹ́ pé wọn ò lè jẹun without a bottle of Coke. Yes, some of them jẹ bàbá ẹ̀, wọ́n tún gbé Coke ńlá síbẹ̀, wọ́n máa mú wọn máa jẹ. Ìgbádùn bàbá bá ìgbádùn ló ń gbádùn ara wọn. Àmọ́, Yorùbá máa ní kékeré kan jọ̀gẹ̀dẹ̀, ó rẹ̀ dìbò kíkí wọn. Ikún jọ̀gẹ̀dẹ̀, yes. Ó ní ọ̀rọ̀ yẹn o. Coke, Fanta, akọ̀kọ̀ gbogbo wọn poison, they are all poison. Poison, they are poisons. Yes, nobody will say you should not take. Sometimes you just feel like something cold. But when you are taking any of those, you know that this is not good for me. But I can't just resist it. I'm taking it, yes, fine. But you know that it's not good for you. It will not turn into a habit of what you will be taking morning, afternoon, night. So, I gave that example. I want to load the system. Unfortunately, nínú àwọn condition yìí, ẹyẹ kan tí mo mention nínú àwọn disease tí a lè ṣe wọ́n pa ní hereditary. Hereditary means pé nǹkan tí èèyàn bá inherit látọ̀dọ̀ àwọn òbí èèyàn. Somebody that has a father and mother who both parents are hypertensive at a young age, there's a high chance that that person too will become hypertensive. Somebody tí àwọn òbí ẹ̀ ní hypertension, there's a high chance tó máa inherit lọ́dọ̀ àwọn òbí ẹ̀. Ṣó lè ṣe nǹkan pa yẹn kò lè ṣe nǹkan pa ẹ̀ tí a sọ pé ó belong sí class bí age gender bẹ́yẹn pé nǹkan tí wọ́n bá inherit látọ̀dọ̀ àwọn òbí èèyàn ẹni tí ó inherit property bàbẹ́ àbí ẹni tó ní inherit property bàbẹ́ ó mọ̀ pé òun lè ti inherit àwọn problem tí bàbá òun náà bàbẹ́ ìlànà àjọṣọ́ náà ó lè ti bàbẹ́ náà sára kì í ṣe ogún bàbẹ́ nìkan ló máa pín o. So there's nothing you can do about that. But irú èèyàn bẹ́ẹ̀ yẹn tó bá wá live healthy lifestyle, perhaps that's in hypertension, you know, but later in life. Kó jẹ́ pé bí èèyàn tá à ń sọ yìí, bàbá ní hypertension, ìyá ní hypertension, ẹ̀gbọ́n ẹ̀ ti ní ohun kò tiẹ̀ check BP ẹ̀ kàn mọ tí ó ń ṣe fàájì, ó mu sìgá, ó ń ṣe oríṣiríṣi lọ. Tó bá jẹ́ pé ẹ̀kọ́ ní hypertension ẹ̀ ní 50 years, ìgbà ló máa ti ní, kó tó 20 kó lè ti ní. àbí ó fọwọ́ ara ẹ̀ fà súnmọ́ ó fọwọ́ ara ẹ̀ fà súnmọ́ dáadáa ó fọwọ́ ara ẹ̀ fọwọ́ kúfà àbí so those conditions are there so we must realize that even if you live a healthy lifestyle some conditions you will still develop them especially depending on your family what runs in your family what you have inherited in your family your genetics again àwọn olèmí máa ń kúrú family wọn ẹni tó kúrú family ẹ̀ kò bá jẹ̀wà kó jẹ kí ní kan kò lè ga dúró ìwáka náà lọ àbí ẹni tó ń ká family wọn tí ò bá ló jẹ dáadáa ó sì lè ga ó lè má ga tó àwọn yòókù so that is genetics it plays a role in it but àwọn èyí tí ó pé ó wà lọ́wọ́ wa òun là ń sọ̀rọ̀ nípa tẹ́lẹ̀ pé you must try and control ẹni tó ní high BP for example tó bá ń lo oògùn tí BP ẹ̀ control risk BP ṣáà ti lọ diabetes if you have risk of developing diabetes and you are taking excess sugar what is the person doing especially the refined sugar gbogbo àwọn coke fanta all these things they have high level of refined sugar you are loading your system highly the risk may come the diabetes may develop earlier than expected abi so we also talk about cholesterol dàbí ọ̀rá nínú ara fat cholesterol what they do is that with the hypertension diabetes they end up blocking the pipes tí ẹ bá dá àwọn pipe omi míì tí bí green máa ṣe sínú ẹ̀ báyà bí tó wọn máa block díẹ̀ it may happen like that just like that in the system nínú body ara wa tí ẹ bá ní excess cholesterol lára ó lè block àwọn pipe tó wà nínú ara ẹ̀ ó máa cause complication now àwọn other more common risk factors tí èèyàn bá sanra ẹni tó wà obese ó ní high chance of developing problem so bí ẹmọ̀gẹ́ ilẹ̀ Yorùbá ní pé tí èèyàn bá ń sanra máa ní pé èèyàn ń gbádùn ní àbí ara o èèyàn kí èèyàn máa don't view when somebody becomes rich he's eating excessively he's eating unhealthy and he's getting fat you should advise the person you should watch your weight it's very important because those are the risks of developing cardiovascular disease sitting down in one place for a long time sedentary lifestyle is commoner in women sedentary lifestyle àwọn ìyá tó ń tajà tó ní shop ọmọ àjókòó sójú kan àbí ọmọ bá ń gbá bọ́ wá bá ń gbé ẹgbàjẹ́ wa ẹgbẹ́ wa kí n wo mẹ́ customer kan yẹ lọ dáhùn lọ́dá lóhùn lọ gbọ́bẹ̀ wá nulẹ̀ some women can sit in one place tó ṣe bọ́ọ̀lì láti nílé tó jókòó sínú ṣọ́ọ̀bù wọ́n lè jókòó sójú kan yẹn bí i ẹni tó fẹ́ lọ kírun ẹni tó ní kírun ó ní lọ́ọ̀kì láti lè lọ kírun á padà wọ́n lè jókòó sójú kan àti pé bá lọ tọ̀ di ìdálẹ́ tó bá lẹ́nu máa tó rìn wọlé that is what we call sedentary lifestyle kéèyàn máa jókòó sí ojú kan gbogbo ìgbà ó máa increase the risk gbogbo àwọn pátásọ yẹn hypertension diabetes stroke gbogbo ẹ̀ bẹ́ẹ̀ kéèyàn máa jókòó sójú kan gbogbo ìgbà ó máa increase risk tí èèyàn bá tún ṣe exercise ìyàtọ̀ wà nù kéèyàn máa jókòó sójú kan àti kéèyàn máa ṣe exercise mean pé a fẹ́ jẹ́ kéèyàn rìn kó rìn bóyá kó rìn fast kó làágùn exercise yẹn kó máa ṣe yẹn bí ábí ẹ̀mẹ́ta ẹ̀mẹ́rin lọ́sẹ̀ exercise ní kó sáré o kó máa sáré kò ní láti sáré ibù kó rìn kó ṣe ẹni exercise tó máa jẹ́ kó sweat àwọn mi lè lift weight yes kò ní láti jẹ́ routine don lift ní gym tó máa lọ ṣe àwọn léṣe yẹn o something that you do just to warm your body just to exercise walk round it's very important àwọn tó bá ṣe exercise is a risk too what we eat oúnjẹ tá à ń jẹ excess salt in food ó increase risk hypertension ẹlòmíì tó máa gbóúnjẹ fún lórí table ó máa ṣe gbèrè yọ á fi yọ sí á tún mix ẹ̀ papọ̀ that is very risky behaviour adding salt on table is a very risky behaviour so you must try to cut down on your salt intake cutting down on salt intake to start with you will say no added salt on the table that means when they cook for you there's no now for our mothers that cook ẹ máa wò ó pé tẹ́ bá ti fẹ́ ṣe oúnjẹ iyọ̀ yẹn kàkà kẹ́ ẹ fi bí a ṣíbí kan sí ẹ dínkù ẹ mọ̀mọ̀ dínkù díẹ̀ tó yẹ kó ti dùn tó bá ti dùn díẹ̀ náà ó ti wà ókè ẹ máa sọ fún àwọn dáàdì wa because àwọn ó lè mọ àjà pé hopefully bí some of them will be educated too because the more salt you take the higher the risk of all this question tó fẹ́ bèrè ni pé àwọn bàbá wa láyé àtijọ́ ṣọ́ máa ń jẹyọ̀ ó lè sọ pé wọ́n jẹyọ̀ máa sọ pé lẹ́gbẹ́ wá pọ́n jẹyọ̀ máa ní kí ìbọn náà ti rí Òyìnbó ló fún wa ní iyọ̀ jẹ náà. Was there salt in Africa and gold? I don't think there's salt in Africa because I don't know where to get the salt from. Salt is processed now. I mean iyọ̀, wọ́n máa process ẹni now. That means ó mì pé èèyàn lè jẹun without salt. That is what it means. Ó mì pé àwọn kan gbá ìgbà wọ́n ń jẹ oúnjẹ kò sí iyọ̀ nínú oúnjẹ tó ń jẹ. Torí pé a ti wà use more iyọ̀ tá à ń jẹ. That is why if there is no salt we feel the food is not sweet. It's because we've got to use it over time. It takes a lot láti wá train ara èèyàn reverse. You must train yourself. Ká máa train ara èèyàn pé kí n reduce your díẹ̀. Tó bá jẹun tẹ́ bá sọ oúnjẹ tó ní ẹ bá ní iyọ̀ ẹ̀sọ́ wọn oúnjẹ yìí. Tẹ́ bá rún oúnjẹ nìkan tí ẹni ẹ bá jẹ tó wá fi iyọ̀ sóúnjẹ jù, you will not buy food from the place again because you don't want excess salt. Salt is dangerous. It's not good for the system. Excess salt. You can use little. No, they are promoting some new kind of salt now, but I don't know. Àwọn kan máa ní kíkan sea salt. Natural salt is a lie because in fact they're dangerous. Because I heard some people were now selling sea salt. Only killing sea salt. Is there anyone salt that is not from sea? I mean, sea cannot get the salt before. So they are all dangerous. So we must cut down salt in our food. In consuming excess fried things, nǹkan tí wọ́n dín is not good. Ṣẹ́rí àwọn epo kan wà sọ pé wọn ò dáa. We don't know where they get them from. Bóyá they are badly produced. Àwọn yẹn kéèyàn tí láti avoid ẹ̀. Bí o ṣe lè avoid ẹ̀ mi ò mọ̀ torí pé even kan tó pé orúkọ òróró kan ló dáa. Olówó popular kan fún orúkọ kan. Bóyá ká ní Mica vegetable oil for example ló dáa. Before you know it, àwọn kan máa tún lọ wá lọ rọ fake sínú àbí. But let's even assume that you are buying original healthy oil, maybe plant-based oil or good oil, healthy oil. No matter how healthy the oil is, the more tẹ́ bá ṣe fry it, the more you fry it, the more it becomes unhealthy. Àwọn kan nínú ilé wọn frying pan yẹn báyìí wọ́n lé òróró mẹ́ ẹ̀pọ̀. Wọ́n bá ti fẹ́ dín dòdò, wọ́n máa gbèrò, wọ́n dà sí i. Tó bá dín dòdò tó wọ́n á wà jáde, wọ́n á lọ jẹ dòdò. Tó bá dọ̀la tó bá ti fẹ́ ti ẹja, wọ́n á dà sí the same oil. The more you heat the oil, the more the oil becomes poisonous. So, option, use you can grill. Instead of eating fried plantain, you can grill. If you must eat fried plantain, use minimal oil. And you light fry it. Don't reuse it. Reusing oil is very dangerous. Now, kini kan chips, plantain chips, pumpkin chips, chips here. How do you think they produce them? All those chips, fried, how do they produce them? Industrial frying, very dangerous. One double best in the rope. To fry, they will bring it out. Then they put another set. They'll bring it out. Put the next set. Bring it out. Put the next set. Healthy oil. Would they buy healthy oil? They want to maximize profits. You understand? Some of these you may end up eating them, but they are not things you will now become. You will not take as your habitual. Because you don't get chips be bag in the office. As you are doing that, it's an habit you are putting yourself at risk of developing cardiovascular disease. Again, so consuming. So what we eat is very important. When you eat food that is less in vegetables and fruits, it's also risky. When your food should have enough vegetables in it. So basically, those are the risk. Some of the risk factors that has been identified. But we should remember that no matter what, when you live, there's a 50 something year old man that's mountaineering, or he's called like we have not hiking, not hiking. That means I want to master the mountain. Exercise is here. He does a lot of exercise. Live healthy, does everything. But he had heart attack. Some doctor said, why? I live healthy. Why will I have heart attack at this age? The question is, what of the other siblings? Some of them maybe at 30 years, at 40 years. Because you are living healthy, at least delay, your development of complications, and also ó jẹ́ kó wà minimal, at least may not be so severe. Okay, so one other aspect kan fẹ́ fún wa. Okay, so a ti sọ gbogbo àwọn ìṣòro tó lè ṣẹlẹ̀, àwọn kan tó fa gbogbo ìṣòro àti àwọn risk ẹ̀. What are the tips we give ourselves? I've mentioned some of them, but let's start from the beginning. What is most important is to be truthful to yourself. What is the most important? Ní kí ẹ wà truthful sí ara èèyàn, èèyàn onítàn ara èèyàn jẹ. If you are living a lifestyle that is not healthy, you must always try to change it. Very important. And you know, I mentioned that our condition here, they are like iceberg. Iceberg, I don't know whether I'm iceberg. Lórí omi, ẹ̀rí kan tó tí iceberg form lórí omi, ẹ̀rí ice here lórí omi. Majority of the bag kini ó wà nísàlẹ̀ omi. Nǹkan tó ń fa kini yẹn ti ń rúbọ̀ tipẹ́tipẹ́ before it gets there. So it means when you are 40 years and above, you should do what we call medical screening regularly. Èèyàn ní orí òfò ẹ o, inú òrùn ẹ o, ojú òrùn ẹ o, nothing is wrong with you. But just go and screen yourself. Why? That may be when you will know that you are hypertensive. That may be when you know that you are diabetic. That may say you know that there's cholesterol. Alpha. That may be when you know develop. You understand what I'm saying? Say your overall work. So we do one campaign. We call it Know Your Numbers. At every point in time, don't have a low again. Mama, kí ni blood pressure yìí? Ẹ lè má lè sọ, ẹ kàn ní pé but tó máa check ẹ̀, ìgbà kan check ẹ̀ láàṣọ máa wà bí 130 to 80 something. It means kí ni? Ó mì pé ẹ wà conscious. Mama, kí ni blood pressure yìí? Èmi ò jẹ́, èmi ò worry. Ìyẹn dangerous. Ẹ jẹ́ kí fún ilé example kan. Wọ́n gbé young boy kan wá fún mi 42, he was 42 years. Àwọn ẹ̀gbọ́n ẹ̀ ló gbé wá pé kí wọ́n bá wọn rí. He was 42 years. Bàbá wọn, bàbá àti ìyá, there are 2 girls and a boy. Bàbá àti ìyá wọn, both were hypertensive. I think mother had stroke at the early age, at 50, mother died at 50 something, stroke. The 2 sisters, ẹ̀gbọ́n ẹ̀ méjèèjì yẹn, the first sister and the second one, at the age of 20 something, wọ́n ti were hypertensive. The sisters were hypertensive at a young age, maybe 25, 26. At the younger one, the second one did the same thing. But the youngest brother, he at the age of 42, they brought him to me. You know what he had? He had stroke for the second time. Only stroke ní ẹlẹ́ẹ̀kejì. Ó ti ní stroke èyí. Àwọn àǹtí ẹ̀ wá gbé wá. And what is the story like? This guy, when the sisters were taking care of themselves, wọ́n check BP, wọ́n lóògùn. Èmi ò lọ hospital, I'm always fine now. Mo be fit, mo wà fine, mo fine. He never, nobody labeled him as hypertensive because he never checked. Abi? Nobody could say he was hypertensive because he never checked. At the age of 40, only stroke. At 42, only stroke. So screening is very important. The man on screening, but that's when you will pick somebody that is hypertensive. The man tell sugar, sugar in 340. Oh my God. Everyone lost hospital. They will go to hospital, they will check. You can manage. When I was in Bauchi, I treated a lady for 20 years. Diabetic, they rushed her to the hospital. We were treating her. Egwene, to the doctor, was 60 something years at that time. He came and said that I shouldn't mind the sister. Now she's irresponsible. What is big about being diabetic? They are all diabetic in their family. He is not 60 something years. Can I say that? Is there anything wrong with him? It's fine. But she's not thinking of herself. They are their father in the 60s, Baba won. At the age of 30 something about diabetes. In the 1930 something, 1930 something, 1940 something, Baba won diabetes at a young age. And when you go in Nigeria, don't want Nigeria, they used to treat the father. Nígbà yẹn kò oògùn diabetes ò pọ̀. Ẹ mọ̀ bó ṣe ń treat diabetes náà yẹn. Ó máa ń dín àárọ̀. Wàá tọ̀ síbi test tube yẹn wàá da chemical sínú ẹ̀. chemical yẹn agbèrànà lágbèrànà á rí colour tó show ń bẹ̀ colour yẹn tó bá rí colour tó show nígbà tó ń gbé chemical yẹn àti ètò ìraná ó ló máa fi mọ ibi tí ṣúgà tó wà rẹ̀ á wá lọ ṣí ìwé tí wọ́n fún tó bá ti ṣíwé yẹn á wo colour yẹn á wò pé okay it means I should eat so amount of food á wá gbé oúnjẹ á wá gbé sórí scale yẹn ló máa wo oúnjẹ tó máa jẹ. That is how he was managing diabetes there because he was taking care of himself. The man lived long of 70-something years before he died. Which means whatever it is, the most important thing is what? To take care of yourself. And as I give an example, picking that condition is important, which is what we will pick, like what? When we come to a program like this, I'll check if BP go, ever hospital, can monitor blood pressure. Do you understand what I'm saying? Medical screening is very important. And Thomas Ope, you have any condition. Okay, don't worry. Go to the hospital. Go to the hospital. And you got patients. You got ní sùúrù. Unfortunately, when we go to the hospital, one part of the patients, our patients involved. Meanwhile, these patients are highly impatient. Unfortunately, they are called patients, but they are impatient. Somebody will say that, I thought I want to go to bed. Doctor. I go meet you, doctor. It's natural because ìwọ ní kọ́kọ́ lọ wá sí hospital ẹni tó wọlé torí kó lò more than 5 minutes lọ́dọ̀ doctor take time láti explain fún tó bá di time tiẹ̀ náà wọ́n náà ò ní fẹ́ lọ àwọn doctor go explain fún ẹ dáadáa. So when you have a condition you go to hospital èyí gbọ́dọ̀ lọ pẹ̀lú sùúrù pé máa farabalẹ̀ ní doctor no matter what it takes. It is not only in Nigeria, all over the world. When you go to hospital you spend time in the hospital except emergency. It's all over the world. So, you must ensure you go to the hospital and follow it up. Very, very important. Àwọn machine tí wọ́n fi ń check ìfúnpá, ó dá ká rà sílé wa. Kéèyàn bá ṣe the boys nísìn tó ń set up lé kó máa ra TV, ara fridge. Ayé ìgbà yẹn kí ló máa ra? Ó máa ra fídíò. Kò sí ní tó ra fídíò kò sí. Ara fídíò free TV. Ló máa ara bed, ara rug, ra rug mọ́ sí. Kò ṣe ní kíní tó fi ń ṣe ìfúnpá yẹn. Ó pè kó ra o. You can ask your doctor what type to buy. You buy it too. It's useful to you, useful to your family. Níjọ́ tí dáàdì bá wá kí ẹ, dáàdì ẹ jẹ́ kí n máa ń check ìfúnpá yín. Tí wọ́n bá wọ́n yẹ kí n máa ń check ìfúnpá yín. Ẹ̀gbọ́n ẹ wá, ìwọ náà check títí ẹ, àbí? If you go for any program, someone don't check BP on, not when you problem. I'm to play ball. Go and check your blood pressure. Someone find this where you will go. So how do we arrange this thing? So if you have hypertension, you go to hospital, they will advise you. It is not every time that we give drugs. For every condition, we say that it is non-drug treatment, then we have what? Drug treatments. There is non-drug treatment, there is what? Drug. Sharing non-drug treatment, it is also treatment o. Ẹlòmíì a lè má fún lóògùn. Tá bá sọ àwọn nǹkan tó máa ṣe ẹni tó kò ó mu sìgá, ó mọtí, ó sanra, ó ń ṣe kiri, BP ẹ high. Ibi tó bá ti bẹ̀rẹ̀ ọ̀rọ̀ ẹ̀ ni pé ṣé wàá fi sìgá ilẹ̀ tó mu sìgá mọ́, kò mọtí mọ́, ó ń ṣe exercise, ó lose weight yẹ. Ìyẹn náà lè bí BP ẹ wálẹ̀, a lè má fún lóògùn. Wọ́n tá bá fún lóògùn a lè stop ògùn yẹn torí pé ìyẹn wà ìpọ́tà kì í sọ. Tọ́lá wà lórí ma ní pé reason táwọn òyìnbó fẹ́ gba ògùn ni pé wọ́n ní tí èèyàn bá ti bẹ̀rẹ̀ ògùn yẹn gbére ni o ní stop rẹ̀ irọ́ ni o. The only thing is that it is only your doctor that can stop your drug. Okay, now I don't think you need drug again because somebody that is smoking, drinking, is not doing exercise, is big, is this. Down full ogun. By the time we stop those things and blood pressure is coming down, we may decide that blood pressure is quite rather. Let's try and reduce the drug. The man reduce it. Oh, my person can okay. You may not really need this drug. Let's try you 3 months, Malogo, or 2 months, Malogo, come back. Okay, normal, okay. We are off drug. You may need it later in life, but now you don't need it. It's important we say that. Because I want to come out, share my point. Unfortunately, àwọn tí ò ní knowledge, àwọn ni wọ́n máa offer advice in the environment. The people that lack knowledge, they are the first to respond. See, ẹ̀kọ́ bá ṣubú báyìí sí. Ẹni tó bá kọ́kọ́ fò débẹ̀, òní tó ẹni tó wà likely láti ṣe wrong thing. Gbìrì ló gbé kìí sí lẹ́nu, ẹ̀dá mi sí lórí kíní kan, kò mú kankan. ó máa worsen condition ẹni yẹn. Lórí TV gbà kan níbi tí wọ́n ti ń ṣe budget ní Senate bọ̀bọ̀ kan tó ṣe wẹ́pẹ́ òun rí wárápá báyìí tó ṣe defense president tó lọ bá kí ẹni yẹn ṣe ó kọ́ ọ̀bọ̀ lẹ́nu ó fẹ́ fa inú ẹ̀yà ó fọ́tẹ́kùn sí ẹnu. I mean, it's very ridiculous. Most of people that will give you advice, they lack knowledge. They don't have knowledge. In fact, they lack knowledge even more than you. So for me, they are the ones that want to give you advice. I'm a man of people who go bushi o, and then the things will get worse. Could I want to go on stroke? One thing, stroke. Wait, my worse than you could. Those are lies. There are people that develop have stroke. No matter that they will get better. So you take your drug after also agree to comply on the lifestyle. No matter the drug, you take it as prescribed. If you have any problem pẹ̀lú oògùn yẹn, especially àwọn ọkùnrin tó wá fún olóògùn hypertension ó lè ní pé kò jẹ́ kí ọmọkùnrin ó ṣe dáadáa. Kó oògùn yẹn lọ bá dókítà kó lọ fún padà pé oògùn tó fún mi o, problem tó ń fún mi lélẹ́yìí o, ẹjọ́ discuss ẹ̀ ó possible oògùn yẹn kọ́ ló ń fà á, ó possible nǹkan míì tó ń ṣe ni, ẹjọ́ discuss ẹ̀ ó lè change oògùn ẹ̀ sí nǹkan míì. You understand what I'm saying? So when you are using your drug, use it, whatever decision, take your decision with your doctor so that what you can. And even when you are taking your drug, you must still go back and do regular follow-up with your doctor. So, at this things never to take. Well, as Muslims, the Muslims shouldn't take alcohol. But whatever is taking alcohol is at low risk. Alcohol is very, very dangerous. Some people will tell you that a small amount of alcohol is good for the heart. They will study that the rubbish. You understand? They can say there's a safe limit of alcohol, but it's not. There's controversy around it. Smoking is also a no. You ask because some people, because they say it's Quran is about cigar. But if you are smoking, you are cooking yourself for danger, for complications. So, and the good thing is that immediately enter cigar stop, the risk will start going down. Don't say that I'm going to smoke for 15 years. Oh, the smoke will have caused damage in my body. No. When you stop smoking, the risk will start reducing. Anything you can exercise, try and deliberately do exercise. It's very insignificant. At least that is preventing sedentary lifestyle. That prevents sedentary. 5 times daily, it's very important. To exercise separately aside from that, at least someone also will take you to stand and move around. Those are part of the things we are talking about. Any deliberately try to work on the weight. Any deliberately work on his weight. One thing Marshall could likely to not gain weight. At least nobody may weight only gain. But I'm gonna lose here, no matter what, gradually. How do you lose weight? Part of it is that avoid all these refined sugar, coke, Fanta, all those other cheap ways of very unnecessary things to the body. Eat more of vegetables. And vegetables and food, they are good to the body, not all those so much over sugary vegetables. They are very good to this. But so take vegetables, they are good. Do exercise. Exercise also helps to maintain when you lose weight. Exercise will also help you to maintain that weight. Because when you lose weight, you can gain it back. So when you lose weight and do exercise, it can also help you maintain that weight. Well, there's a lot to be said. My song for health for over and over solo. But we have limited time. But what is most important, as I said, is to check yourself. Go to your hospital when necessary. Go to another hospital that maybe you think is small, because there are many people that may not have knowledge. Some non-doctors go on from under hospital. So just ensure you go to a competent doctor to help diagnose, help treatment, and do all what you need. Well, we pray Allah subhanahu wa ta'ala forgive us, make everything all where we have said. Go and use it for èèyàn máa ń gbọ́ nǹkan, èèyàn máa ń try láti implement it. I mean, difficulties máa wà, may Allah make it easy for us. And no matter what we implement, no matter how little effort we make, Ọlọ́run jẹ́ kó bá wa lára kó jẹ́ So you have something that will be beneficial for us, both in this world and the hereafter. Assalamu alaikum. If there are questions, maybe we'll go to answer.